Good afternoon, everyone. I have a question for the audience. How long would you like to live? And I'd like you to think of that number. Then I'd like you to think of the next number. How long would you like to live if you were healthy? I assume that for most people that's a different number. How long would you like to live if you had the anatomy and physiology of you when you were 25? And that's what scientists are trying to work on right now. Forward-looking statement. This is very important.
From the day we're born, we're on the clock. At first, we have all the time in the world to do anything we can imagine. But the older we get, the more time weighs on us. Our bodies and minds start to fade. The world sees us differently. We feel our time is running out. But what if we could slow down the clock? If we could stay healthier longer, would we change our plan for tomorrow? Would we spend more time with our families today? What would we do with more life in our lifetime? At Juvenescence, we're on a mission to find out. We're creating a community of people who refuse to let age define us. We're fueling their brightest ideas, developing revolutionary therapies, and getting them into the right hands. Together, we're not just reimagining what it means to get older. We're reimagining the possibilities of a lifetime. So what would we do with more life? Let's find out.
There's 3 or 4 elements that are really important in that message. One is from the day you're born, you start to age. The second one is that we're going for Healthspan. If you ask me what Juvenescence is trying to do, it's trying to allow you to live longer healthy. The discrepancy between when you die and when you're last healthy, on average, in the developed world is 10 years. Wouldn't it be amazing if it was a week, a day, an hour that you're healthy? And the last aspect of it is prevention. If you are truly going to modify how you age, you have to prevent the disease from ever happening. Juvenescence is somewhat unique in that field. Within chronic aging and anti-aging, most people are going after therapies for the diseases of aging. Very important is that you're going to invest in a biotech company, is that they've done it before. So hopefully I'll demonstrate that today. The next thing is you want to have a world-class team, which is very, very important. And you want to have a diverse pipeline. I don't care who it is, they cannot tell you which drug definitively will work. So the goal is to try and have a diverse pipeline and be right on 2 or 3. It's a model that we've used successfully and then have multiple opportunities for value creation. These are my 2 co-founders, Jim Malone, many of you may have heard speak earlier today. Jim wrote a book called Juvenescence, same name as our company. He basically gave Declan and I a roadmap of which company to approach, which institutions, which scientists were cutting edge for modifying how you age. Declan was the former head of drug development at Pfizer. I've worked with him for 14 years. He's been amazing at picking which products are going to work. I've had the good fortune to work with extraordinary people like Jim and Dec, and had my companies go through $25 billion in market cap. Bring 2 products to market. One is the number 2 drug in the world for prostate cancer, and one is the leading drug in a new class of drug for migraine called Nurtec. The banks are way out ahead of investors. Citibank says it's going to be one of the top 10 most disruptive technologies of this decade. And as you can see, Bank of America says it's going to be a $500 billion industry. The opportunity to invest, whether it's in Juvenescence or any of our competitors, in an industry that's going to go from 0 to $500 billion is extraordinary. So you should all look at this and take this area very seriously. This is, again, a point of differentiation from almost all of our competitors. If all of us in this room had a drug that allowed you to live 8 years longer healthy, we have no way to get it on the market today. The regulatory bodies do not have a pathway. If we have a supplement that does exactly the same thing and it's safe, we can get it on the market within 2 years. In 6 to 9 months, we will be launching a product that I'm about to tell you about in the presentation. When the animals took it, they lived 25% longer. It protected their brain and protected their heart. And what's interesting about the flow of the patterns between the two is we were looking for them as drugs and then found out they were safe and that we could get them on the market and help patients or help people, help healthy people, and begin our journey with them to modify how they age. Equally, we've had supplements we've seen that I think actually have pharmaceutical qualities. We bring pharmaceutical rigor to the supplement industry. Big diseases. If we wiped out all of these diseases, most of them are the top 10 leading causes of death, and if there was no disease, and the only way to die was accident, suicide, and homicide. Does anyone want to take a guess on how long you'd live? Sorry? 1,024 would be the average lifespan, and one person in 5 billion will live to 25,000. I would be bored out of my mind. This was interesting. I'm a drug developer, so I was in awe to see these numbers. $1.5 trillion are being spent on wellness. It's growing at a tremendous pace when it's that big a number. 10% is extraordinary. And because of COVID, people are taking control of their health. Whether you took vitamin D3 during COVID, whether you looked into all the alternatives, people are now trying to take the responsibility for their health care, which is why nutritional supplements that are backed by scientific rigor are going to be incredibly powerful. I said you need a diverse pipeline. We have 6 pharmaceutical agents and we have 4 supplements that modify how you age, which I'm about to tell you about. And it's not moving. There we go. Have a world-class team. Declan, I told you about, former head of drug development at Pfizer. David Roblin, vice chairman of the scientific committee at the CRIC. Former head of European R&D for Pfizer. Grazia Pizzi from Novartis and Merck. Steve Felstead ran clinical development at Pfizer. And Jeff Medweb is from Merck. The reason we have all of these is because, much as I'd like to say aging is a disease so we can get a regulatory pathway, it's not a disease, it's a process. And we have to interrupt the process and we have to do it on multiple levels. So having the diversity of products that you see is very important. This is our first one, and this is the one that stunned me, and it's Jim's favorite for how going to be the most successful product we have. In the United States, a liver transplant costs $800,000. Probably costs about 400,000 pounds here. Unfortunately, there's not enough livers. There's usually about, in the UK, there'd probably be 60,000 people who need a liver transplant, and there are probably only 3,000 livers. So what Eric Lagasse did was he took a liver that didn't have a recipient, divided it into 75 bits, proliferated it, and he injected it into the lymph nodes that drain into the liver and into the hepatic duct. And when we did our diligence, what was extraordinary was that the lymph node with the liver tissue reacts exactly the same as the liver. Same GI tract symptoms, same blood things trigger the release of the product. And 400 animals who would have otherwise died of liver failure were able to keep alive. We're in a clinical trial at Mass General, which is associated with Harvard, phase 2 clinical trial on this product. What if we took those same cells, beta islet cells, pancreatic cells, we put them into the pancreatic lymph nodes? Could we obliterate type 1 diabetes or type 2 diabetes? There's endless options with this product. And the other thing is the thymus. Thymus creates T cells, and unfortunately we don't know too much about T cells because of COVID. What if we did the same thing with the thymus that decays at 3% a year every year after 25, and we wiped out immunosenescence, the aging of the immune system? We just published this article recently. In this, we amputated the leg of a frog. Frogs should not regrow a limb. What you're seeing is the regrown limb. What's extraordinary about this, what did you just see? You saw the leg react, motors intact, sensory intact, bone, muscle, nerve. They regrew a limb in a living entity that should not regrow a limb. We're now giving them money to try it in mammals, in a mouse, with a prelude, hopefully, to human beings for people who have amputations. Wouldn't it be great to combine it with stem cells? This has been the dream, that you would damage a tissue, we would inject the stem cells, it would graft, they'd function perfectly. There's 3 types of stem cells. Embryonic stem cells make every tissue in the body. But the problem is that it creates a tumor called a teratoma. It's a benign tumor, but you don't have a benign tumor in your heart. Adult stem cells are most of the therapies right now that people are using. Adult stem cells are programmed to self-destruct in 2 days to 2 weeks, so they're not the treatment. Pluripotent stem cell makes every cell in your body as well, doesn't create a tumor, Now, I can use those stem cells. We could have a syringe with heart tissue, cardiomyocytes, in every hospital in the UK. Somebody comes in with a myocardial infarction, we inject it. They're one-day-old cells, they engraft, they beat as one. Or a spinal cord transection, we re-anastomose the spinal cord. But then you're going to need to be on immunosuppression. So we also in-licensed HLA-G. HLA-G is the protein that protects the fetus from the maternal immune system. So it protects every cell in the body. Now you could have that tissue in every hospital and it would engraft and you don't need immunosuppression. You're going to hear a word called senescence. Aging cells senesce. And when they do that, it means they stop functioning as they're supposed to. So they leak. And they leak proteins that cause osteoarthritis, acute macular degeneration. One of the forms of Alzheimer's disease is probably done by the same thing, the senescent cells. There's a number of competitors that are going after senolytics. These are drugs or agents to selectively destroy the senescent cells. We've gone downstream. The main SAS elements that are causing the inflammation are GDF15 and activin A. So if I make an anti-GDF15 activin A, I should be able to prevent this. We are trying to prevent you from ever getting ill. That's truly how you're going to modify aging. This also declines with age. It's called NAD. There's a number of companies that will give you an oral NAD agent. We're not sure it gets into the cell. So again, we went upstream. So we're working with CD38, which when you modify it with a drug called NAPA, it allows the NAD to get into the cell and reverses it. It's one of the 4 major pathways of aging. This one was fascinating. And basically, the curve on the graph you're seeing here on your right, my left, the blue line is people who have one gene. If you have one SERPINE1 gene, you live 8 years longer than healthy people. If you have 2 SERPINE1 genes, you have a catastrophic hemorrhagic disease. So you only want one. But with the modern technology like CRISPR and AAV, which is our ability to edit your genes while you're here in this room, we could do it with a viral vector. We can implant that gene and potentially allow you to live longer. We also have drugs for that. We just in-licensed this, very excited about this. First indication is going to be fibrosis. Fibrosis of your kidney, 13% of the developed world has that. Fibrosis of your liver, 15% of the developed world has this. These are huge diseases. We want to prevent you from ever getting them. This was very exciting in our product that we were going to, originally when I saw it, out of the Buck Institute, 200 of the top scientists in the world trying to modify how you age. They wanted it for heart failure, but that's a really tricky clinical trial. So we managed to convince the 2 scientists that we were going to take it as a supplement and make it available to people who had cardiac issues. And we did that, and then we found out that actually it works on a very unique form of heart failure called HEPA heart failure, which has no current treatment. So this is a huge opportunity to improve the lot of life of people who have this form of heart failure. It also may work in epilepsy. So we've taken a supplement, we brought it over to the pharmaceutical side, and we're using it now to go on to clinical trials. Which brings me to our nutraceutical side. This is our team here. Get a world-class team, have a diverse portfolio. Colin Watt launched Splenda, launched Benecol, was president of Weight Watchers, and was CEO of the Vitamin Shop, the 2nd biggest retailer of vitamins in the United States. Perfect guy to run this division. Todd Henges ran Pfizer's vitamins and supplements. Josh Anthony has created an app to tell you why and when you should take it, and I'll touch on that later. PhD in neuroscience as well. Terry Finocchiaro is one of the top vitamin scientists in the United States. Joe McCarthy was the head of marketing and advertising for Nike and Johnson & Johnson. This is our first product. It'll be here in 6 to 9 months. And my friend over here, David, has a keg of it so he can show you what it looks like. And it drives you into ketosis in 15 to 30 minutes. So there's probably 2 or 3 million people in the United Kingdom who are trying to get into ketosis, so they're starving themselves. In 15 to 30 minutes after you take this, you're in ketosis. You'll be there for 3 to 6 hours. We ran the clinical trial. We're bringing pharmaceutical rigor to the nutraceutical business. We know that when you're in ketosis, your heart prefers ketone. It functions better on it. It was used by riders in the Tour de France because it's a food. It's legal to take, but it makes your heart function better. It's also neuroprotective, which is why it may also work in epilepsy. And it affects gut health. So we've got this extraordinary product that you're going to be able to buy. It's going to cost you under 3 pounds a day. And in the animals that used it, they live 15 to 20% longer. So just get a slightly smaller cup of at Starbucks and take the powder to live longer. The next one is sulforaphane. It's the active ingredient in broccoli. Unfortunately, you'd have to eat a refrigerator full of broccoli to get an adequate dose. It works on the master regulator switch for oxidation. The reason that your cells die is oxidation. If I can slow oxidation, I improve your health and you live longer. It will work as in the gut, detox, and a potent antioxidant. It's available today. You can get sulforaphane. Unfortunately, the sulforaphane you get should be sent to you refrigerated, and they don't send it to you refrigerated, and it should be kept refrigerated. We've managed to stabilize the product so it doesn't need to be refrigerated. This one's very interesting other than having a very bad name. Autophagy cleans up the proteins in your cells, which again becomes a huge problem as you age. And this one, if it's used topically, will actually slow the aging of your skin and your hair, which I can attest to. It's nasty. You do not want to have your skin and your hair aging. It also improves gut and heart health. Our product, many of you may not know what Crispr is. Crispr is this ability to edit DNA. It's like scissors to go in and snip the DNA and put in the new gene. We're using Crispr with yeast to create 98% pure spermidine. Currently, if you go online, you try to buy spermidine, it's about 1 to 5% pure. So that's a huge difference. This one's the biggest one of the four. This is something that, as you can see, should be even in infant formula. Remember we showed you the baby and I said aging starts then. This is one that you want to start as early as you can. 40% of your plasma cell membranes are made up of plasmalogens that decrease when you age. This supplement will bolster that. It's going to have a profound effect in cognition and heart. And as I said, should even probably be in infant formula. It's that profound. This is an app we created. There's 300,000 health apps. So how are we differentiated? Why should you use it versus Fitbit versus the Apple Watch? Basically, this is actionable. You give us the data, whatever data you're comfortable with, and we'll make recommendations. So if you gave us your HbA1c, which is telling me how good your glucose is, we can make recommendations about what you should do with diet. We also have the Life Band, which we've patented and trademarked, I should say. And it will tell you if you do this, this is how much longer you'll live. We now have an algorithm we've developed with a Dutch group where we can actually begin to give you informed information. You increase lectins, which are beans. We now know that can increase your lifespan by up to 10 years. We also know that there's certain foods that will decrease your lifespan. So this is an interactive app. It also speaks to whether you should do high-intensity training or endurance training. And if you give me your VO2 max, how your lungs function, we can make a lot of recommendations. The more information you give it, first it's going to be for consumer, and then we're going to use it to interact with physicians. And then the third outcome is to bring in very sophisticated machine learning to make this very much part. Also helps us with your journey. We'd like to start with you when you're 20 and you're healthy. And so this gives us a mechanism to begin to interact with 20-year-olds and also, reinforce why you should take metabolic switch if you give us your ketones. Every one of our products was tested on animals and they lived longer and they were healthy. So to start a veterinary division cost us the price of hiring Andy Weatherly, who ran veterinary at Pfizer. We're already in discussions with the largest pet food companies in the world about putting this into pet food because the animals live 25% longer. So, multiple pipeline products in your pipeline. Try to be right on 2 or 3. You'll deliver an extraordinary return. That's happened before for our group at Medivation and Biohaven, where we had one hit right, one went to 14 billion, the other one went to 8 billion. So we hit this right. If we get the one for Alzheimer's disease, which we're looking at, which would prevent Alzheimer's, it would be a pill you would take at age 50 that we're working with MIT and Harvard, then it's probably a $100 billion a year product. It would be extraordinary. Founders have a track record, world-class science team, diverse pipeline, multiple opportunities to do it. We're never hiring 10,000 sales reps. We're always going to be licensing these products to participate in the upside. We have a number of inflection points in 2023. We're hopeful that we go public within the next 12 to 18 months. We are doing a financing now. Then we're rolling into that. And you can hit up David. Do you want to stand up for a minute? That's David Gill. If you have any questions, ask either one if you want information from us or if you want to follow our story. Juve Labs is our website, which has a lot of health information, and it has a lot about ketosis and why you want to be in ketosis. And as you can see, we have a number of readouts. We have a couple of joint ventures. We've almost already monetized 2 of our machine learning opportunities. We've got the lymph node product in phase 2 trial. Classically, you license after phase 2. And then you get to have your dog and you get to live longer healthy.
Thank you very much indeed. So I actually binged on your website yesterday because I'd heard roughly about ketosis. I didn't really understand how it worked, but you've got lots of very good information written in very inclusive language.
Thank you.
So your portal, your shop window, pre-IPO is it's very enlightening. So yeah, you've got that spot on. So well done in terms of that. So I'm quite sure that I've got time for 2 questions from the audience. So this gentleman here, and you're second. So this gentleman here, please. And then we'll go to you.
Hello, thank you. It's very interesting. I wonder what the big pharmaceutical companies think of you. Do they see you as competition? Are they likely to take you over?
I met with Fiona Marshall, who is running the anti-aging program for Merck Serono, and she goes, I'm not sure how we interact with you. I said, sure. In a few years, we develop a product, you pay us multi-billion dollars to license it, and we participate in the profits. I think that they're going to massively underestimate this market opportunity, because if you have a fibrosis drug, they're going to think that this is for fibrosis. They're not going to think that this is an anti-fibrotic, which is going to completely change how people live. So we're definitely going to want a royalty. So my goal with Big Pharma, and I would say that of my business partners like Jim, who's in the audience here, is to license these products to go forward. They do not do well at early stage R&D. And so I think that we have a compelling opportunity to develop this. And most of them, and this is across the board, even throughout the whole anti-aging sector, they're not working on prevention. And if I truly want to modify how all of you age, we have to do it early. And it doesn't mean that you can't start it at 70, but it'd be much better if you started at 20.
This gentleman here, please. It's just coming to you.
And then I'll tell you 5 things on how to live longer, 50% longer.
This gentleman here. Here, this gentleman here in the cap.
You're right. It's regarding cognition health. With your product, I know like the creatine can aid towards the products that you read that can aid towards cognition health, and collagen, which will can help your skin and hair growth and lots as well. So I was wondering, like, how do your products like give a bit more of an edge to it than if there's products out here already that do these things?
Yeah, I mean, if you walk into your Boots drugstore, you're going to see 1,000 things that claim they're anti-aging and they're not. I'm sorry if I'm dispelling any myths that you might have. We're trying to work on the primary pathways of aging. We're going to run a clinical trial to make sure that it's double blind. So if you did the same thing with collagen, you'd probably be surprised at how they don't really live up to expectation. Alpha hydroxy, retinoic acid probably do. They're a better model for things. So show the clinical trial. The metabolic switch, we were just notified by the Department of Defense in the United States, they're giving us $10 million grant. Because when you take it, you feel energized. You feel mentally acutely aware. 66% of people. There's some people who don't feel it, but most people do. And so that's fantastic for a military personnel deployed in some obscure place to have that sort of mental acuity, energy, perhaps when they're running out of energy. So then Ohio State University is running the clinical trial with us, $10 million to prove that it actually does what it says. Same thing with all the other supplements. You know, we're going to prove that they actually do change your gut health, or they actually do modify how your heart functions. So I think that's a big difference, you know, and we've got to do that to rise above, you know, the clutter of products that claim they're anti-aging. So to live longer healthy, it's your basal metabolic rate, keep it down. It's HbA1c, make sure that your blood sugar's under control, your lipids under control, cotinine, low cotinine, which means you don't smoke, and I can't remember the 5th, and low blood pressure, and stress. You know, managing your stress well. And if you do that, you live 50% longer. The other thing I'll say is Walter Bortz, who runs gerontology at Stanford, said if you're fit, you decline mentally and physically at 0.5% a year. Unfit, 2% a year. Huge difference. So
And Greg,
those are the easy things to do.
if you keep talking, I'm going to be stressed.
I'm done.
I'm going to have to chase you. But this is Greg. Thank you very much.
Cheers, everyone.
Thank you.